I am a Professor Dr. Orooba Mohmad Saeed Ibrahim from Iraq, Baghdad. Age 6 years, work in University of Baghdad in veterinary medicine. From the child can be suffering from dislocation in the right hip joint, and all this time is suffering from pain and limping. Before 5 years, make surgery in India, in New Delhi, in Fortis Hospital by Dr. Navin Talwar and Dr. Mini, but this surgery is not correct and is not successful. Still pain and still limping, and the right leg is when walking enter to side. After this, make surgery, another surgery by make tendon dislocation, but still suffering from pain, and after this can be by Dr. My friend Dr. Oma, can be find the Apollo Hospital in Chennai, and Dr. Shanker, and can be continue with you, can be make this surgery and coming to Chennai before 4 months, and make this surgery for revision for the right hip joint. Good surgery, and it's comfortable, and good walk, good team for surgery, for assistant and nursing. It's good hospital. It's very happy and nice for good walking, no pain, no limping. Thank you.
Hi, this is Dr. Navaladi Shanker, Senior Consultant Orthopedic Surgeon at Apollo Hospital, Chennai. We are talking about Dr. Orooba, who was flew from Baghdad here to us, and she is presented with a painful hip. The main cause of the painful hip was because she has already undergone a hip replacement because of the birth, congenital birth. They call this old congenital dislocation of the hip. And once she had a primary hip replacement, and it didn't come for long, and it failed early. So she was walking with a painful limp almost for 3-4 years, and she communicated to our Apollo Hospital through our International Patient Services Department, and we had a lot of communication happening through our International Patient Services. Mr. Jitu, who was there helping us to get the pre-op x-rays and evaluation done for the patient. And after seeing the x-rays, we found that it's a failed hip after the hip replacement, and she was suffering, and then we had suggested that she flew down here and to have the revision hip surgery. So what is revision hip surgery? When we're talking about revision replacement surgery, is the removal of the painful processes or any infected process or the loose bodies in the hip which has caused the failure of the hips. Revision surgeries are usually done at the big centers like our Apollo Hospital, the corporate hospitals, because it is not like any primary surgeries. It needs a teamwork. So it's a long hour surgeries. It may take about 4 hours, 5 hours or 6 hours, but the results are very good. So most of the people, they are afraid to undergo revision replacement because they feel that already one surgery done and then again second surgery it's going to be painful, but it is not so. With more and more technology coming, and the revisions are happening more, we do a lot of revision surgeries at Apollo hospitals. Why I say the teamwork means because we should have a good theatre environment, that is the laminar flow theatres, because infection is a commonest thing which we see in the revision surgeries, and to prevent that we need a good teamwork, good OT staffs, good instrumentations. All of them play a major part, including a good physiotherapy. our Vice Chairperson Preetha Reddy and our Director Medical Services Dr. Bama, who has always helped us to get the quality of all the theatre things, which will help us to do such kind of major revision surgeries and help the patient recover faster. So Apollo Hospital is equipped with all the type of the instruments which is required for any revision surgeries, and it can handle all the revision surgeries so that we can give a better results for the patients. And with this, I would like to tell them who are already undergone a primary hip replacement or knee replacement, in chance by various reasons, if it fails or if they have a painful hip or a painful knee after the first surgery, they should not give hope, because there is definitely a possibility of revision surgery. We are talking about revision surgery is definitely useful for the patient. Like you can see here, Dr. Orooba, who had a primary hip replacement, but it failed, and then she was afraid that there is no other treatment, but we had made her confident that don't worry, once we doing a revision surgeries, and she will get back to her normal activities. And now I am happy to see her that after the revision hip surgery, she is able to walk and go back to her university and do the work. She is driving a car, and then she is doing most of her work independently. So that makes us to see happy. And then I think revision surgery should be done major centers like Apollo hospitals, where we can handle lot of things, because when you talk about revision surgeries, we have to really make ourselves equipped with so many things. It is with the starting from the ward, starting from the theatre, starting from the infectious disease people coverage, starting then going on to the physiotherapy. It's a big teamwork, and then that team we are equipped to handle any type of revision surgeries and give the best results from our center. You are right, complex revision surgeries where we need lot of, because we have to we see the x-ray, we ask for the x-ray, like International Patient Services got in touch with you and they send the x-rays, and then we template the x-rays, we make the implants available. Sometimes when there is a defect in the bone, we have to make the bone graft, allografts get ready for the surgeries, and the various instrument use, it is not one or two. So the lot of work before the surgery has to be done, the homework has to be done perfectly. And once we do the good homework, and then the results are definitely going to be excellent. That's what.
Good work and no pain. Going to my work to the University of Baghdad by driving the car. No use the stick and no use the walk. Very happy and can be thank you for Dr. Shankar and for the hip revision and complex surgery too.
Thank you. Thank you. Dr. Orooba Mohmad has come here for revision surgery to Apollo Hospital, Chennai. The revision surgeries are the complex procedure where we remove the infected or loose or painful primary processes, and then we put a new revision processes so that the patient are able to lead back to the normal life without pain. So we have a good equipped theatre for which the laminar flow theatre, and we need to have a good team. It comprises of physician, cardiologist and good anesthetist and the ID specialist. Follow up, we need a good amount of physiotherapy. The lot of homework has to be done in case of revision hip surgeries, and then once the homework is done and it's properly done, the patient can get back to their life normally. So we do all type of revision surgeries, like what our Vice Chairperson Preetha Reddy and our Direct Medical Services always feel, what is happening in US or UK, we have to get it here. And the type of revision surgeries what we do in Apollo Hospital, Chennai is in par with any part of the world.